When it comes to the symptoms of chronic kidney disease, anemia is one of the worst. But what the heck is it and what can you do about it? We're going to talk about that and more coming right up. Hello, kidney warriors. James here with Dadvice TV, your online kidney health coach, and welcome to my fast-growing YouTube channel. Why did I mention fast-growing? Because this is video number 49. Holy cow! There are 48 other videos of me sharing information to help you fight and beat chronic kidney disease, boom, 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 and avoid dialysis. Wow, that is a huge milestone. Now, if you haven't done so already, make sure and subscribe to my YouTube channel by clicking the little subscribe button and click that little bell icon right next to it. That way, when video number 50 loads, you get a notification and all the other ones after that. Because together, we are a community and we are powerful by using information to change our lives, change our diets, and beat chronic kidney disease and kick dialysis to the curb. Now, let's get on to today's topic, anemia. So what the heck is anemia? Well, your body has all sorts of cells in it. One of the important ones, especially when it comes to anemia, is red blood cells. And on your lab test, that'll usually be abbreviated RBC for red blood cell count. And associated with red blood cells is a thing called hemoglobins. It's something the red blood cells carry around with them. And what the heck do red blood cells do? Well, they go to your lungs, they pick up oxygen, and then they deliver that to all the other organs around your body. And when you have anemia, you don't have as many red blood cells as you used to have. Your body's just not producing them. So what's that mean? Less oxygen getting to your organs. There's not as many of them going to your lungs, picking up oxygen and delivering it. And that's really critical to two really, really important organs, your brain and your heart. So how is anemia related to chronic kidney disease? Well, first, anemia is one of the most common symptoms you will suffer if you have chronic kidney disease. Now, it doesn't start right away. Usually it starts around stage 3, and as your kidneys get worse, it gets worse. Stage 4, a bit more. Stage 5, practically everyone suffers from anemia. And the reason is because your kidneys create a hormone called erythropoietin, also known as EPO. EPO tells your bones to create red blood cells. That's where they're created, right there in your bones. That's why it's important to watch your bone health, your vitamin D and other minerals and nutrients needed by your bones. They do more than just hold you up and keep you, in your right shape. They create red blood cells, and those red blood cells go to your lungs, pick up oxygen, and deliver it to your organs, especially your brain and your heart. Now, other common causes of anemia in people with chronic kidney disease is from bleeding. It could be from hemodialysis. You'll lose some blood, and blood loss drops your red blood cell count, so you're not getting enough of them, picking up enough oxygen and delivering it to the organs in your body. Or you could have a deficiency of iron, B12, and folic acid. Iron, B12, and folic acid are used to make hemoglobins, and hemoglobins go along with the red blood cells carrying that oxygen to deliver it to your organs. Let's now look at the symptoms of someone who has anemia and chronic kidney disease. They will suffer from weakness, fatigue, or feeling tired. And fatigue is something you cannot take a nap and have it go away. It's always there. Unexplained headaches, problems with concentration. Your brain's not getting enough oxygen, so it has difficulty concentrating. Your skin will be pale. You'll also get dizzy from time to time. You could have breathing difficulties or get shortness of breath. As a matter of fact, just getting up off of the bed and walking towards the door, when I was stage 5, just before I was diagnosed, I had to stop to take a break because I was out of breath. That was severe anemia. And the last symptom is chest pain. Now, anyone having trouble with breathing or difficulty breathing, shortness of breath, you gotta see your doctor right away. If you have chest pains, that means call emergency assistance. Here in the US, that's 911. It could be a serious heart issue, and we don't wanna mess around with our heart. And speaking of our heart problems are a very real complication from anemia. These could include an irregular heartbeat or an unusually fast heartbeat, especially when you're doing something active like exercising. You can also have the muscles around the heart can get larger, which is very harmful for your heart when those muscles get big. You can also suffer from heart failure. Now, heart failure does not mean your heart stopped beating. It means it's not beating enough to deliver enough blood throughout your body. Let's look at how we treat anemia in those with chronic kidney disease. The first thing your doctor is going to look at is your iron levels, and they may give you iron supplements to boost your iron levels, which will increase your hemoglobins. Now, if you're on dialysis, pills don't usually work that well with iron, and you usually need it intravenously. So they're just going to hook it up to an IV and give it to you during your dialysis session. The second thing your doctor is going to look at is your erythropoietin levels. If your kidneys are damaged too much and they can't create enough EPO to tell your bones to create red blood cells, your doctor could prescribe a genetically engineered version of EPO that's given to you in an injection. It's really simple, given to you by a nurse. As a matter of fact, some people who need it often give the shot to themselves, just like a diabetic taking their insulin. Now, those of you on hemodialysis, it will be given almost always automatically intravenous to you during dialysis. Number 3 is a red blood cell transfusion. If your hemoglobin level drops too low, you may need to have a transfusion, giving your body more red blood cells to deliver oxygen to all of your organs. Now, this is fairly rare, but it is an option for those suffering from serious anemia. My second favorite treatment is vitamin B12 and folic acid supplements. Yeah, you can use supplements to prevent or treat anemia. And B12 and folic acid are the supplements your doctor will recommend. Now, don't just run down to CVS or Walgreens or Target and buy supplements and start popping them. You always need to talk to either your dietitian or whoever's taking care, whichever doctor's taking care of your kidney disease before adding supplements. They could have interactions. They may not work well for you, but talk to your doctor. Also, that's why I strongly recommend these Pro-Renal Plus D multivitamins made for us kidney patients. These have those B vitamins, the folic acid, and so many other things that our body needs when we have chronic kidney disease to stay healthy and fight off things like anemia. And of course, my favorite treatment is diet. Yeah, you can take the supplements to get the things that you're lacking, but you can also adjust your diet to get the iron, to get the B12, to get the folic acid. Whatever other symptoms you have, you can also adjust your diet to give you those nutrients. And if you haven't watched my video on optimizing your diet based on your labs, go back, watch that one. It is great about adjusting your diet so you don't have to go in and get transfusions and injections and all that stuff. Now, one of the challenges though, many of the foods that are high in folic acid, iron, and B12 tend to be high in sodium and phosphorus. So you gotta keep track of that. Use an app to track the amount of sodium, phosphorus, potassium, and other nutrients that you're getting so you don't exceed your daily limits. Remember, we're not trying to avoid 100% phosphorus or sodium. Your body needs these and everything else. It just needs a certain amount. There's a minimum and a maximum, and you want to stay in there. So if you're going to eat something that has B12, folic acid, iron in it, and it's higher in phosphorus, just account for that and eat less phosphorus in another meal throughout the day. It's all a balance. Portion size, quantity, what you get and what you got. You want to keep everything right in balance, all right? And diet is my favorite and probably the most affordable and easiest way to address problems like anemia, especially early on, stage 3, stage 4. Now, I suffered from anemia extremely bad. I cannot believe how bad it was. I could not walk from my bed to the bathroom in my room, not down the hall, not around the corner, in my room. I could not make that walk without getting short of breath and stopping. Right after I got out of my 7 days in the ICU, where I learned I had chronic kidney disease, the day after, I tried my hardest to go to a mall. Family was there, we went to a mall just to kind of get out, see something different besides the same hospital room. And it was difficult. I was walking really slow, tiny little steps, and I had to keep stopping and taking a breath. And the people that were with me, you know, they questioned, are you healthy enough to be out of the hospital? It was anemia. It was lacking the red blood cells I needed to carry the oxygen to all the organs. And I was just so weak and so tired. And when someone suffers from anemia, if you're watching this video for a loved one, no amount of resting makes up for it. You know, for people without anemia, when you're tired, you take a nap or you go to bed, you go to sleep, and you wake up rested. With anemia, you need sleep, but it doesn't fix it. It's still the same when you wake up. So if you know someone who's suffering from anemia, look at helping them, especially with their diet, and understand they're going to get tired easier and they need a little bit of help. And your support can help them. And if you are the one suffering from anemia, let me give you the hope. You can get rid of this. Even at stage 5, you can treat and remove anemia from your list of symptoms. All right, but it takes a lot of effort, and sticking to the right diet is my recommendation. Now, a lot of you are probably wondering, well, James, when you talk about diet and how important it is, what foods can I eat? I'm creating another video that's going to talk about what you can eat, the foods I used, and a little tip on how I prepared them, because believe it or not, when it comes to iron, the cookware you use can make a difference. Yeah, whoa! May not have known that. That's going to be in the next video. All right, so that's a great overview of anemia. We talked about what causes it. It's a lack of red blood cells. They carry hemoglobin, which carries oxygen to all your organs. You're not getting enough oxygen. You're suffocating your organs, especially your heart and your brain. You're going to have trouble concentrating. You're going to be extremely tired, weak, fatigued, dizziness. You could have heart problems. Be careful. Anemia can be dangerous. It needs to be treated. And there's a number of ways your doctor can help you treat it. And one of them, my favorite, is diet and supplements. And I'm going to plug it again. Okay, this multivitamin, okay, to be clear, I get nothing, not a penny for promoting this and talking about it. I'm promoting this because it works. This bottle's empty. This one, I emptied this bottle. I'm on another bottle. I'm on like my 3rd bottle, I think, right now. These are so many pills in here, 80 of them, take 2 a day. Now I get the one with the omega-3 because I have heart problems. I had a heart attack from my kidney disease. So I need the omega-3. They make a version of this without the omega-3. The pills are teeny tiny, little tiny things, which give you the vitamins and the minerals that we need, that we are usually deficient in with kidney disease. this is one of those multivitamins that can help you fight kidney disease and get rid of anemia or prevent anemia. And this is different than the Centrum and the other multivitamins that you're buying. These have the doses, they're in the right type that absorb correctly into your body. It doesn't have the things, there's some vitamins that are bad for us to take with kidney disease. This doesn't have those in it. So I encourage you to look at this. Ask your doctor, ask your dietitian. A lot of dietitians will give you a free sample of this. They've got little bottles of it. It's also the National Kidney Foundation down there. The dialysis centers support that. They recommend it. If you're going to buy it, you can get it on Amazon. But I called the manufacturers. Remember, I saw them in person. Boom, boom, feet away from each other and talked to them. Great people. And they set it up that those of you who want it, you can purchase it directly and use the reference code Dadvice, not TV, just Dadvice. They'll give you free shipping, 20% off, and you're getting it direct from the manufacturer. You know it's fresh. They just produced it and they're sending it off to you. Some of the things you buy online, those of you who shop a lot on Amazon, you know, you buy something, it expires in 30 days. Like, how long was this sitting in a warehouse, getting hot, cooling down, getting hot? What happened to it? Is it still good? Get it direct from the manufacturer. You can go to dadvicetv.com, click on the supplements tab, and right there's their phone number, their email address. Now, many of you are not here in the United States that are watching these videos. Guess what? They have a way to ship it to you. Now, shipping can get expensive when it comes to international, but there's a company, and the instructions are there on dadvicetv.com under the supplements tab. There is a company where you can sign up, doesn't cost you anything, and they will give you a Florida address here in the United States, and you will then have your products shipped to that. Then you pay them, they repackage it and ship it internationally to you. You can actually go on before you order, sign up on their site and see what will the shipping cost so that you know, is it worth it? Now, for people in other countries, it may be good to see if you have other people and order multiple bottles of this in one package so that you all are sharing on the shipping, which will decrease the shipping cost per bottle. But I highly recommend those because it does help with anemia. There's a lot of things we suffer from with chronic kidney disease. Anemia is common, and having the right nutrients will help you to not get it or reduce it and treat it, take care of it. All right, and one last time, if you have not subscribed already, this content is great. It's completely free. Free! How can you beat free? Subscribe to my YouTube channel. This is video number 49, helping you fight and beat chronic kidney disease, avoid dialysis. Those of you on dialysis, these are tips that can help you to improve your health and get off dialysis. It is possible. It's rare, but you know why it's rare? Because the doctors don't tell you how to do it. Chances are that dialysis center you're at is a franchise. You're a customer. They don't want to lose customers, but it can be done. Takes work, takes dedication, takes determination, a little bit of luck, but it can be done. All right. Thank you guys for watching. Please share my videos. Let's help get this information out there. And let me know in the comments, do you suffer from anemia? What did your doctor recommend to help you overcome it? I know what most of you are going to say. Yeah, I suffer from it. My doctor told me it's just one of the symptoms. Never told me I could use diet to get better. They never talk about that. My RBCs, my red blood cells always down. My hemoglobin's always down. They never said a word. That's what the majority of you are going to say. And if you're a doctor watching this, this is the type of information other doctors tend to give those of us fighting with chronic kidney disease. They're so focused on that. We'll just get you on dialysis. It'll be okay. You'll go in 3 days a week, hook you up to the machines, suck all your blood out and filter it. They're so focused on that instead of helping us, telling us about the other options and helping us with diet and lifestyle changes. All right, everybody, I'm going to jump off my soapbox. Enough of that. I'll see you guys in the next video.